Hi, everybody. Thank you for joining Synthetic Intelligence Forum Online. My name is Vic, and I'm very happy to welcome on our live stream today Ewa Kleczyk, who's an expert in AI for healthcare. And without further ado, I'm going to pass it to Ewa so they can talk about advances in AI for healthcare. Ewa, so most welcome to the Synthetic Intelligence Forum Online from our community members. And the floor is yours. Your slides are shared. Take us away. Thank you.
Hello, everyone. It is a pleasure to be here and speak with you about healthcare and how AI and machine learning can help move the industry forward and what the applications of it are and where we are headed in the future. A little bit about what we're going to discuss today. I will start with a little background on myself, talk a little bit about some of the trends that are happening in the industry, talk about importance of healthcare data, and then move into applications of machine learning and AI in healthcare industry and how we are utilizing the information and the methodologies. I will also speak a lot today about some of the very important aspects of doing machine learning and some of the recommendation and best practices, since we are in healthcare and dealing with prediction of patient disease and other risks. It's very important to understand that it's not only methodology and AI and all of the technology, but it's also other aspects more related to the research. But without further ado, let me briefly talk about myself. And let's hope I can move the screen. Right there. So as Vic mentioned, I'm a vice president of custom and advanced analytics at Symphony Health. I've been with the organization for several years, leading the organization in many different capacities. From client analytics, syndicated analytics, through privacy, as well as through advanced and custom analytics on my side. I had the pleasure of working with many great leaders within the industry, as well as provide some mentoring to upcoming women leaders, as well as other leaders in the advanced analytics organization. Personally, I went to Virginia Tech for my PhD, and I'm also a part-time graduate faculty at the University of Maine. So what are some of the trends that we are noticing? Many healthcare organizations, whether they're going to be integrated delivery networks, hospitals, or consulting organizations, are thinking about how to ingrain themselves in the analytics and how to leverage data to best inform the next decisions. So as the industry is moving and as the industry is thinking through how to be on the analytical journey and create that pathway forward, there are a few things that need to be thought about. First of all, data and analytics need to become a core business function. Very often, not many individuals, not many leaders thought about data analytics as the primary key for making decisions and creating strategies and informing the next steps for the plan for the organizational success. However, in today's world, especially with COVID, we all realize that data is everything, and understanding how to analyze it and how to provide insights has a very important aspect and part of the organizational structure. The second, third, and fourth is really thinking about how do we move as many decisions into an automated sphere, whether they are small or large or something in between, thinking about engineering decision intelligence and how can help leaders automate some of those tasks and make those decisions more accurate, repeatable, transparent, and traceable, allowing a better decision making and ultimately accountability across the organization. The next thing is thinking about ML ops, as well as all of the automation related to all of the different platforms. As we are moving through the journey, it is very important to understand the best practices, share across the team, standardize the approaches, and ensure that the approaches are reliable, reusable, and repeatable across the time. And the final part in the spectrum is really understanding how to take the data and put it in the layers that data scientists and other researchers can take them and consume them in a simple way or easy way without requiring too much of an effort to take the many different aspects and many different sources of data. That all leads us to the last aspect, which is, or the last point, which is really data strategy and governance. As we have more data, as we have more technology to consume the data and ultimately provide the data scientists for analysis, what we need to think about it is, what are the strategies? How are we going to acquire? What data are we going to acquire? When are we going to acquire? How we going to be onboarding it? How are we going to be governing it? What are the security as well as the access aspects that we need to think about it, and ultimately the overall management? So with that, as we are thinking where we are headed from the data part, many organizations are creating positions for chief data officers. And that position has recently become very important for the aspects that I just discussed on the previous slide. First of all, we need to create a strategy, very clear what data we are bringing in, when we are bringing it, how we're going to be onboarding it, and then creating governance rules and policies related to how we're going to be managing them and who's going to be able to access them and when and to what level once the data is brought in. This type of position has become, as I mentioned, quite important within the healthcare industry, but it also in other organizations as well. So with that, let's start moving into machine learning and AI and the application in healthcare. The first thing that I want to mention is machine learning is not just data science. And I think we all know that technology is very important, and in the recent years with the improvement in technology and ability to consume a lot of data and process a lot of data, we definitely have made quite an improvement. We also know that there is a lot of science related to this. The algorithms that we are selecting, the statistical modeling behind it, and also how we're gonna create the right variables for the model. But there's also one part that very often is not thought about when we are thinking about machine learning model and design, is really the art part. And when I mean art, I'm not thinking about painting a picture, but it's really creating the appropriate design, having the appropriate questions, working across other organizations or teams, like with medical experts or healthcare experts, epidemiologists, research the design experts, as well as business analysts, to truly understand what the question is, how to build those models, and once we run those results, are they actually relevant to the question at hand, and can they be dependable, can they be reusable, and are they going to work after deployment into the real world? So before we go into very specific applications of healthcare, of AI in healthcare, let's talk a little bit about the data that in the United States we have for our disposal to do some of the analytics, or very often available. First of all, there is a anonymized healthcare claims data sets that can be leveraged to understand the different trends, the decisions, and how patients move through the healthcare system and how they consume healthcare overall. The data might be coming in from hospitals, from pharmacies, from wholesalers. We might be also looking at lab data, EMR data, medical imaging data, as well as at this point currently very often there is also the wearables data, which allows us to look at how patients are consuming health, how they are behaving, and what types of actions do they take. All of that is at our disposal. Obviously, we have to follow the appropriate privacy rules to ensure patient privacy at any given point, but it gives us a lot of venue to think about the types of models and insights that we want to be deriving when it comes to looking at healthcare and application of advanced and predictive analytics. So why patient-level data? Why think about it? What are some of the aspects that are very important when we are looking at the data? First of all, we need to think about what is the actual market size, what is the actual therapeutic area size. Very often, these questions might not be fully known. They might be known for diabetes or other therapeutic areas, but maybe for rare diseases, there is still a lot of questions about how large some of those therapeutic areas are. The second thing is looking at determining patient adherence. Very often we hear that patients are not compliant, or they stop drugs usage and ultimately suffer consequences or develop other comorbid conditions. Looking at patient-level data, looking at healthcare data, allows us to really investigate it and identify the determinants that are driving the potential non-compliance, non-adherence, and what are the factors driving the actual adherence for those patients following the treatment guidelines. The next part is thinking through the patient journey that each patient takes through the healthcare industry. Who do they see? Who do they go to? Which physicians they've seen? Where do they get their imaging done? Where do they get their testing done? What prescriptions are they being put on, and so forth? So all of the consumable aspects of patient care can be mapped out, and barriers as well as the benefits to those identified as well, and then studied to provide a better way of looking how to optimize patient access to healthcare as well as treatment and diagnostics. And finally, understanding real-world evidence as well as clinical trials. How can we leverage the information? How patients are performing, how they are feeling after getting some of those medications, and how can we improve or bring to market other treatments that might help some of the patients who currently are not stable on certain therapies. So what are some of the aspects or some of the applications of machine learning? And the examples that you see here on the screen are really high-level examples, but they are hopefully to all of you quite realistic, and many of you have heard of them. First of all, disease detection. DeepMind can help us with retinal disease predictions, so who the patients will be. Genetics and bioinformatics, very important, especially right now when you are talking about diseases like oncology, which treatment might be dependent on that. Recommendation systems, it's a real-time ICU interventions, very important, especially for patients who had transplant or had very severe surgeries, so we can predict the risk for having sepsis or having other complications related to those surgeries. Outbreak predictions, whether it's Google flu trends or COVID trends that we have seen, they are very important to our health, our public health, as well as understanding where some of these diseases, infectious diseases, are happening, so appropriate prevention can be taken. And then finally, monitoring patient health. All of the wearables, all of the data that we all on our watches are consuming and checking on a daily basis to make sure that we put enough steps, that we exercise or stand for enough amount of time. All of that information can be put into machine learning engines and then create insights, can create predictions and forecasts that ultimately can help us in informing the next steps, creating policies and best strategies for improving patient access to healthcare. So let's drill in a little bit more. What actually are we looking at when we are thinking about using machine learning in healthcare? What are we doing in practice? There are several different trends in predicting the disease. So for example, one of them is when we are looking at the aspects of predicting disease, where machine learning has become very important, is looking at prediction of rare conditions. As I mentioned earlier, very often we do not know how large the population is, where the patients are, and also what the characteristics are. Many of the rare diseases don't even have a diagnosis code that we can leverage. So you really need to study that population, and machine learning can help us identify the attributes and the different characteristics that these patients have, so we can then try to extrapolate and predict which patients potentially might be having the disease or will have the disease in a near future. The next type of prediction of disease is for highly heterogeneous diseases. These are those diseases that don't have the same symptoms, that you cannot really map out one type of symptom or multiple symptoms. They are really, patients are experiencing variety of symptoms, and we need to really understand them to almost cluster those patients and see what the differences are to help us then predict where the disease is happening, which patients are more likely to have it, and how to potentially treat it. And then thinking about underdiagnosed conditions and misdiagnosed conditions, again, very important. For some of the underdiagnosed conditions, patients might be going for years without ever knowing what the diagnosis is. So understanding what the characteristics are, what types of testing is being done and the results that is happening, and is there any relationships to other commonly known diseases that can help us understand more about the likelihood for having those conditions, as well as the characteristics of the patient population. For misdiagnosed condition, it's slightly different aspect. You are looking for the exclusions. You're looking for the characteristics that can exclude having that disease, to make sure that we can really identify the patients with a particular symptoms, disease, or risk for having that condition. So once we know the prediction for the disease, the next thing is really understanding the size of the actual therapeutic area or the actual population that might be needed. Very often you read papers in which the numbers cited are saying, well, the incidence is this, prevalence is this. However, this is only based on the data or these assumptions. Well, machine learning studying can allow us to really understand and try to get the number more quantified, so we truly understand the prevalence and the incidence of some of those diseases. The same might be for ambiguous diseases, again, related to either underdiagnosed or misdiagnosed or diseases without any ICD-9 or 10 diagnosis codes that can help us. And then anything related to analogs markets, where we are trying to estimate what similar condition might be, what will be this market size or the prevalence for them. The next piece, which is actually very important, is predicting disease progression. Why is that important? For many oncological diseases or even immunology diseases, very often there might be some types of conditions for patients which do not move very fast, while others move extremely quickly. So understanding and predicting which group of patients each patient is being characterized in, it's very important to ensure that the appropriate treatment and diagnostic tools are provided to them to give them the right patient care at the given time. For some patients, if they progress very slow, it might be years, but we need to know. So we don't bring them to the physician offices too often. But for those who are moving fast, we want to make sure that the access is given at the given time. The next part is related to determinants of treatment. The next line of therapy that is suitable or treatment recommendations. If we can understand the characteristics and what is best suited based on using machine learning models, then we can really help out predicting what the best line of treatment would be and when the patient should be put on it. And then finally, very popular recently is imaging and looking at medical imaging studies and identifying the progression of the different diseases based on those scans and knowing when the scan provides very important movement of the disease versus not. And the last item related to physician and patient segmentation and targeting is really talking about grouping the patients and physicians into clusters, whether it's based on geography or other characteristics, and leveraging that to create either programs for patient education, promotion activities towards physician, but also identifying cohorts and groups of patients that would be appropriate for clinical trials and where to place principal investigators for those trials along with the sites. So as I just mentioned, there's quite a few different applications, and the applications can be more even vast. In hospitals, you can predict, as I mentioned, the ICU intervention when it comes to sepsis, or the risk for coming back to the hospital after having a procedure done, or any other complications related to the treatment. But there is also a few places where we need to think about maybe if machine learning is the right tool to proceed with. For example, if there are only few known variables, do you really need to do machine learning? Or if you know there's only 5 factors that will predict or characterize a patient population or a disease or a risk, do you really need to proceed further? Do you really want to do machine learning where you're still going to learn the same thing? When you're thinking about diagnosis and conditions with very well predetermined pathways or clear test results, we really want to be doing them if the answers are clear and already provided to you. Sometimes simple statistics, sometimes patient journeys types of analytics can help us without doing through the AI and machine learning types of technologies, and ultimately provide us the answers that will be helpful in driving the right strategies and creation of the right policies. So on this slide, you see few examples of machine learning algorithms that can help us solve some of the, whether it's business or healthcare challenges. On the left-hand side, the first window here says rare event predictions, anomaly detection. You can see the different pathways and the different types of algorithms that we can run, from clustering decisions trees through boosting naive Bayes bias, and then Markov decision process, and ultimately creating rules for next best action and alerts to make sure that we identify the patients or the physicians who need help or treatment and in the given time. The second one is for forecasting prediction, disease, and progression. Again, the same thing. You can see the different types of algorithms and the different endpoints that we are measuring in order to help us identify the different outcomes. For example, recurrent neural networks, long short-term memory models like LSTM, and then you can see for patient finding and patient lookalikes, you can look at the multi-layer perceptors and then SVMs or Bayesian or random forest boosting types of models, and ultimately through EHR utilization and analytics, you can identify the type of predictors for risk and switches that is really needed. This is just an example, but there is variety of different ways, from imaging, looking at more deep learning types of analytics, to others where we really can leverage different types of models depending on the data and the endpoint that we are trying to measure. So very briefly, I wanted to walk through some of the steps that we usually take in order to create a model. And there is a reason for it. Very often, as I mentioned, most of the individuals spend the time, or data scientists spend the time in the modeling, predicting results, and identifying significant variables types of section. And this is where most of the data scientists live. That's where most of the decisions are being made. But in healthcare, what's very important to do is really focus on the more softer areas as well. So the first one is cohort identification. First of all, if you don't define your cohorts correctly, if you don't understand your inclusion and exclusion criteria, if you do not know how your cohorts are characterized and then whom you're going to be comparing your target group to, you ultimately, doesn't matter what you run, your answers might not be coming in, or the model results might not be useful afterwards. On the other hand, once you run your model and you have your final outcomes, and it seems like the model is relevant to the medical healthcare side that you are trying to predict, the next thing is that not is very often done, but it should be done, is reward validation. Most models don't fail because we didn't choose the right model for the data. Most models fail, that's because there wasn't a reward validation, and once you do deployment, you might not be able to the model will not work. The model will not perform well in the after actual deployment, and cause a lot of issues, either for over or under prediction of whatever risks or endpoints we are trying to predict. Furthermore, I'm gonna bring those slides in. The other part that is very important along the sides of talking about cohort creation and then reward validation is really thinking about how you're setting up your study objectives, how you then look at the data and make sure that your elements are appropriate for the question and the medical and healthcare aspects of it, and then ultimately how you build your variables and then interpret them at the end. So as we are thinking through, the most important is working with your colleagues across the different aisles, whether it's epidemiologists, medical experts, whether it's business analysts or business leads. Work with them, define the measured outcomes. It's very important to understand them, what they are. Are you looking for prediction of patient diagnosis? Are you looking for identifying when a patient is ready to switch a treatment or a line? Are you looking for a risk for coming back to the hospital after a visit or for a surgery? Clearly define it. Look at your data as a next step. Do exploratory feature and selection and recoding, understand the data, see what needs to be imputed, see what variables you have, organize them in a way that is appropriate for the types of data you have, and then run a little bit of an analysis so you understand some of the dependencies and interdependencies across the variables. The next step, which very often might not be taken, but we highly recommend, is always looking at, from the medical side, the clinical feature review. Bring your medical experts. Talk to the oncologist, talk to the medical expert, to the epidemiologist, sit down with them, maybe use the Delphi approach and review with them some of those aspects and the variables you're looking at and the concepts, and ask them the question, does that make sense to you? Do you think that we can proceed further? When you're working in healthcare and you're doing machine learning, you really need to understand that aspect. Once we have that figured out, once we understand it, we can then go into enhanced feature engineering, which most data scientists do very well. So I'm not going to spend too much time, but the only thing that I'm going to mention is create as much standardization and usability of functions as you can. It's going to make it easier, it's going to make it faster and for coding purposes. And the final aspect is clinical feature interpretation. Once the model is run, you created these beautiful models using variety of different tools and methodologies that you have at hand. How does it match? Does it make sense in the medical and clinical aspect? Can it be truly used? If you gave it these variables, these important data elements for a physician in a hospital, would they be able to say, yeah, this makes sense, I see that often in my patients, and just really make sure that you validate them to make sure that they are relevant to the studied outcome and bring them back to the final outcome that you measured. So with that, as we are thinking through about whom to work with, whom to bring into the healthcare industry, I want to just bring a couple considerations for you when you are thinking about bringing data scientists who can help you analyze the data, or as you are thinking establishing your teams. First of all, you want to obviously find the individuals who know machine learning and AI quite well. They are either data engineers or they're coming from computer science, coming from business analytics. There's many different fields touching that area right now. But they're also beyond the quantitative skill sets and the understanding of the different techniques and methodologies and technology out there right now. There's also other aspects that needs to be noted. Hopefully they know something about the data they're going to be working with. If not, highly recommend for them to learn it, understand the caveats, understand the biases, so you can really capture the actual essence and know where the issues might be arising. But the second thing that is very important is understanding the healthcare environment, whether you work in Canada, United States, EU, Asian countries, Latin America countries, wherever you are working, you need to understand those aspects of it, because ultimately the patient journey that the patient sees, it might be very different, and the data might be capturing different aspects of it that needs to be optimized. And then finally, the last two bullets is really thinking about the setup of the design and understanding how to work with others and learning from them about those softer aspects of data science. This is the art piece that I mentioned at the beginning. Not only running the models, not creating only custom variables or feature engineering, but also understanding how to interpret, how to look at the model and make sure that it's validated, and learning to work collaboratively with epidemiologists, and medical experts, business leaders, to make sure that the models we are developing are really coherent, are relevant, and are validated. So some of the outcomes that you can see here that I put in, once we run the models, there is many different ways to bring it back to healthcare. One, you can think about alerting, creating what we call alerts or next best action. Very often is, so now that you have identified what the drivers are, so how do you then implement it? One way is, for example, creating some kind of promotional campaigns that can go after some of those important characteristics. You can look at patient journey and the outcomes or the different points of stress that we identified and try to create policies or strategies to improve that. You can think about creating forecasts and to make sure that that you can predict how the disease is going to progress, what the patient pool will be for your particular condition, or is the risk at the risk population is going to be increasing. And then finally, think about the behavioral analysis and adoption, how these patients behave, how these physicians behave, how can we help them, what do we do in order to get their appropriate approach. How do we motivate those physicians in the ER, which they need to provide the care to identify the at-risk population? And then finally, finding out where the population is located. The data might tell you only there is northeast, but then when you run machine learning and you do the prediction, you may actually identify that is more in the northwest. How do you change your strategies? How do you provide the appropriate content to make sure that patients get the appropriate healthcare access? And physicians are fully informed for that. The other parts that have been recently a lot talked about is the concepts of medical imaging and the natural language processes, especially for the use in EMR and EHR, which is the electronic medical records or electronic healthcare records, depending on the tool you're using. There has been a lot of work done and a lot of great work, which we are all seeing already being applied in healthcare. Whenever you are going to a physician office, nurses take notes, physicians take notes, you have it all written. So when you go to another physician within the same network, they can access that information and seemingly made those right decisions for you. The same is with medical images. Now we do a lot of the computer scanning where very quickly you can get the results and even interpretation of what was being seen. However, while a lot of work has been done, there's also a lot of work to be done. As we are thinking about creating machine learning, AI types of technologies for deep learning to understand the medical image data and how the scans differ and identifying very minuscule changes, we also have to think about a few things. How to map the actual scans into actual data, because we all are learning from data. We need to have it in a numerical way. So how do we do this? 5 years ago, someone said that by 2025, we may not have any radiologists, where we are in 2021. And right now, radiologists are still very important because they understand some of those nuances when it comes to interpretation. While computer can help us, machine learning models can identify those very minuscule changes. Ultimately, we are still leveraging the medical experts to help us validate them and interpret in a way that can help the patients. The same would be with creating the models. Should you be using pre-established models already for mapping, let's say lung scans, or should you create your own? Should you do this, then how are you going to proceed with that? When you're going to do it? How are you going to play that game of mapping all of those insights? Again, we can apply a lot of different models here. Deep learning, there's many different, like CNN, there's neural networks and so forth. But it's really going to start with mapping the data and the scans into appropriate data structure so we can then analyze it. For NLP, similarly, there is a lot of work has been done, and I think we all see the benefits when we think about electronic medical records and the use of it. But then how do you create natural language processing algorithms that can really decipher the information and can help us with other healthcare data to speed up the process of diagnostics, of treatment, and really give the additional insight? One of the things that I always think about it is, which we see very often, physicians and other healthcare providers might not be coding everything in the right way. They use a lot of shorthands, they use a lot of different language that might not be very known when we are running without any supervision those algorithms. Again, before you create those algorithms, run some preliminary analysis, show them to medical experts, and do your homework first, which I'm going to tell you is going to help you, and it's going to save a lot of time and ultimately save you a lot of trouble in the future. So the last concept that I want to discuss is something that has come up as a result of COVID-19, is the real-time delivery. Well, we might think about real-time delivery of insights as it's been always that it was for it. I think it is slightly different aspect here. If you think about creating trends, historical trends, we've been in an area of very stable 10 years prior to COVID hitting the entire world. What ultimately it allowed us is to do very good predictions, creating synthetic data that we can leverage in order not to have any issues related to privacy, but also being able to create forecasts and really leverage that knowledge to do great predictions when it comes to identifying population. Within the last a year and a half, we have learned that you cannot trust what happened in 2019 because it doesn't have anything to do with what happened in 2020 and what is happening in 2021. So what do we do? One of the things that everyone wants to know is now, how do I quickly and very reliably use very limited amount of data to get the insights, to tell me how it's going to change, how is Delta variant is going to impact, what is going to hit, how the vaccinated patients are going to be impacted. So with that, what we are thinking, and you are seeing some of the examples here, we really have to be flexible. From technology side, use technology that allows us to take a lot of data, mine it through, but also bring it in very, very quickly and be very efficient. And there's many different ways. I'm not going to go into the different types of environments that you can look at. However, from the machine learning, This is where healthcare industry really needed to step in or think about going outside of the typical analysis and think more in the auto space with the autonomous driving vehicles. Think about the forget and relearn types of model where you are not using the large history, but you can bring in, let's say, quarter of the time at a time versus several months in order to do this, and ultimately leverage those models to derive those insights and deliver them via different platforms to your stakeholders for analysis or for actual insights as needed. The last thing that I want to mention, that I want to start as I'm finishing up my presentation, is I talked a lot about the use of machine learning. I talk a lot about where you can how you should be using it, and some of the things that you should be thinking about. This is the most recent article, or a quote from an article about the model that was deployed. We want to make sure that as we are running machine learning models, as we are leveraging data, we are always mindful that everything has to be validated, that everything has to be reviewed by medical experts and peer-reviewed in order to make sure that we don't deploy models that potentially will not be working in the actual world. So what I want to emphasize is always validate, always work with others. Make sure that you bring in the irrelevant SMEs, have them review it, and what might even make better, create forums like this one that you guys are all in here to brainstorm and talk about the best practices. This is what's going to help us create a area and industry and apply machine learning models to ensure that are reliable, relevant, and ultimately can hold up after deployment. So in the last 2 minutes of my presentation, future trends, where are we headed? So I think we already talked a lot about using AI and machine learning in medical imaging, but I would like to highlight again, there's going to be a lot of scrutiny because of some of the caveats and issues we've seen with deployment of machine learning on the other data, on the healthcare data. Is really thinking how we map the data, the scans appropriately to them being able to analyze. We want to make sure that we understand them, that we aggregate them in the right way, and also identify the clinically meaningful endpoints so we can increase the predictability. And the second part that is coming up and has been coming up for a while, but I think it's going to become even more and more, and we need to be very mindful of this, is increased data privacy and security scrutiny in healthcare. Why is it important? I think with COVID we've seen many organizations suffered some, have been beefing up their security. With amount of data that is produced right now, we also want to make sure that patients are always protected and no information comes out. So what I would say is work with your privacy groups, make sure that they understand how you're creating your models, what data you are leveraging, so they can give you the guiding principles for patient protection and privacy protection. And then from security side, the more data you take in, the more you analyze, the more people have access or analysts have access to the data. You always want to make sure that you have policies governing and securing the access. The zero trust policies are implemented. There is a additional identification, encryption, and data masking provided in order to make to secure and protect the data from anyone else using it. Well, with that, I hope you enjoyed the presentation. Thank you again for the opportunity to speak to you, and I will take any questions. Thank you.
Thank you, Eva. It was an excellent presentation. Lots of great insights. We have some questions already here. Maybe we can go one by one. So there is a question here which has to do with. Let's start with this one. So I'm going to put it on the screen. It says, we know that AI applied to healthcare can have life or death implications, as you mentioned, Eva, when it comes to preventing disease, diagnosing disease, building treatment, and remediation plans. But at the same time, we also know that there is bias in AI. There are issues around fairness in AI. So how would you advise sort of bridging solutions from both worlds together?
Yeah, so that's a great question. I think this goes back again as well to understanding your data that you are putting in. It's if you understand where the data is coming from, understand what the caveats are, what the biases are. I think you can then design the models that can either help with accounting for it and working through this, or when you're going to run your models, you will know where those biases are, and you're going to be that much more careful making any interpretations. And I think some of the techniques also require certain types of data sets. It's very important to understand the level of granularity and what you are working with. And what I would say, and I probably didn't talk about it too much here, many data scientists don't interact with statisticians and statistical analysts. I would say you have to, because the framework for statistics really drive how you're going to do your machine learning or your AI or your data setup, and ultimately help improve your model deployment, as well as your model results, as well as then really guard you against or further have a greater understanding of where the biases are going to be showing up. So your interpretation can be that much better, that much more informed when you're going to be presenting to your stakeholders or deploying those models outside.
Okay, thank you, Eva. Next question here is, this is an interesting question too. We know that healthcare providers have very fragmented and sometimes very mixed bag kind of IT environments. How would you advise organizations that may not currently have AI and ML, healthcare organizations, in their IT landscape to move off of, or to at least coexist alongside of legacy and mainframe systems, while also benefiting from state-of-the-art AI and ML systems?
Yeah, that's a great question. I think there is a great debate right now. How do you, first of all, establish data science teams, and how do you have data scientists and those teams work along with technology? And I think there is a great opportunity to bring them all together, but there is also, you have to think about the technologies that you want to employ. Many organizations can't dive in immediately because it's quite an investment, right? If you think about the cloud systems, or you think about some of the software that you really need to proceed with, you might not have the appropriate investment. You might not have the appropriate talent yet that you need to do this for. So creating a strategy that is can step you through slowly, I think, is sometimes okay. Healthcare is a slightly different organization. Don't want to jump in too quickly in some of those more innovative solutions if you are not set up correctly from the infrastructure side. We also need to think about the data that you are bringing in. Not everyone is bringing a lot of data, others are. So what do you need in order to efficiently onboard it, process, and then create the layers available for data scientists in order to tap into. What I would say is, think about your organization, think of where you are headed, and then slowly create that platform or that strategy based on your investment and where you want to be a year, 2, 3 from now.
Okay, thank you, Eva. That's a great answer. Let's start with let's get to this question next. So when it comes to remote patient monitoring, and as you mentioned, Eva, now there is that ability to have in-home sensors, and you can have sort of these wearables and all kinds of other kiosks out in the public locations. So for remote patient monitoring, how do you see AI and ML sort of fitting into those use cases?
Yeah, that's a great question. I think there is a great opportunity here. The thing that we need to think through is, how do we bring the data in use? Do you connect it with other healthcare data already available, or do you analyze it themselves? And I think the one pieces wearables bring in so much information that you really need to understand. How do you interpret that? Where do you use it? And also map it out the patient journey, because it's not the only thing that's going to be driving disease progression, but I think it can help with adding additional aspects to make sure that we understand some of the risks. Let's say for cardiac arrest, whether you have a smart smartwatch, it can tell you what your pulse is, right? It can alert you when you might be getting into danger zone. The same as with diabetes, measuring your glucose level. So I think that comes in as a great way to supplement and add additional data, but might not always be the only data that can help predict the diseases, because it's not gonna include the other aspects when it comes to where you're located, your historical, your patient history, your healthcare history. whom are you going to? Where are you located? If you're located in a rural area, you might have a little bit different journey than if you are living in Philadelphia or New York City, where you have access to great hospitals within your backyard. And I think all of these aspects, all of these determinants are very important and tend to delineate and drive, along obviously with the wearables, some of those outcomes, as well as characterizing the patients into the different groups that we should be looking at, and then creating strategies accordingly.
Okay, thank you, Ewa. That's great. We have another good question here, which comes to, so when it comes to acquiring patient data, what is your view on incentivizing individuals to share their data with researchers and or private healthcare tech companies?
Yeah, that's a great question. I think there is, and I'm going to start maybe with policy first. I think there is a couple aspects. Always make sure that there is patient privacy is being protected, and that's very important. When you're talking about surveys, I think many years it's been always done. You can provide consent to provide answers to questions. You can participate in different social venues where you share your experiences. There is many of them on different social media where you can provide that information, or you can participate in many different studies where you provide that consent. So I think there is a lot of great insights in this, and very often the best, I guess, use of analytics comes in when you have different types of data coming in. If you're thinking about perceptions or the actual patients, how they are feeling and their mood on the given day, or how from their side they are perceiving the condition, can really help move the industry forward, and also help create strategies that can be much more useful when it comes to delivery of healthcare. Very often we don't think about it, but I think that's a very important aspect. It just has to be done in the appropriate way when we are protecting patient privacy and always get consent.
Okay, thank you, Ewa. And maybe we can do one more question. So you talked a little bit about the use of AI, ML for sort of more on the prevention side, the monitoring side. But even if somebody does have a disease, can you dive a little bit deeper, Ewa, into this notion of using AI, ML to spot the progression of a disease before it happens, and then essentially predict some or generate some kind of recommendations or suggestions?
Yes, great question. Yes, so the use is really coming in on the progression. First of all, from the diagnostic side, when are we going to change the line of therapy? When are we going to go to the next level for staging when it comes to cancer? Or when we're going to progress through immunological disease, when it's RA or it's psoriasis or others, to ensure that we understand what the appropriate treatment will be. So what we do is, or how we would recommend this, always look at the endpoint you're trying to predict. If you're thinking about progression, to switch a line of therapy or go to the next treatment that is recommended within the spectrum, always identify that endpoint and look back and see what happened between diagnosis and what happened between the treatment that we are looking, and identifying the key points. That will be one. The second thing is, this is where image data or lab data can really help us understand those differences. When it comes to cancer, obviously we are looking at the changes, let's say for lung cancer in the X-rays, and how your lung are developing. Mapping all of those points and seeing when you change your stage might be very helpful to predicting where the patient is and how soon are they going to be there. Because one of the things we need to remember doing these types of analysis is not only coding for each individual variable, but also for the time. How long did it take from point A to point B to get there? And this way you can really predict, if I'm at this point here, it's going to take 3 months to get to this point on average. Or it might take, let's say, a year or two, and ultimately start differentiating the patients along the patient journey.
Thank you, Ewa. So that's the questions we have. I really appreciate your taking the time to come and meet with our community of AI and machine learning specialists and enthusiasts as well. Really appreciate your sharing all of your insights, and we'd love to have you back in a couple of months to maybe share some more updates in the exciting world of the advances in AI for healthcare. So many thanks from the Synthetic Intelligence Forum community, and we hope to welcome you back again soon, Ewa. Thank you so much.
Thank you, everyone. Thank you.
Bye-bye.
Bye-bye.